So good morning. Oh, I see all the thumbs up. Thank you so much. So I'm looking at you all, but then I'll have my memos up as well. So thank you for having me. Thank you for that introduction. It's always so interesting reading your bio because you think about, we're like going from day to day, just trying to do all our things, get all our things done, and you hear the things that you've done. You're like, yeah, okay, all right, another day. We'll get through another day. So thank you for that very humble reminder of things. So again, I am the executive director of DC Board of Nursing. I have the privilege and the great blessing to safeguard the district. And in that safeguarding, as you can imagine, it takes a very creative eye. It takes a lot of engagement with our stakeholders, internal and external. So I want to thank you all for being here today. And when I'm done giving my spiel, I want to make sure that I leave my email address so you all can directly get to me, because I really appreciate the public eye. I appreciate the clinicians and the administrators and the providers, those that are with our constituents day after day in that care space. I do miss the patient care space, but I'm doing my time now on the other end. My friends like to say you go from scrubs to suits, but I still have a pair of scrubs right here on the back of my door, actually. So you never clock out really. But again, I guess I'll just get right into it. So a couple of really exciting things we have going on in the district. A few memos that have come out from me, a few memos that have come out from our director, Dr. Ayana Bennett. But most of those memos that have come out from me have been regarding testing availability in the district. And again, I am super grateful for our constituents for being so vocal and reaching out and helping us to see what things look like on this end, right? Because a lot of time, you have this aerial view of what you think is happening, but a lot of people have given the opportunity for me to come out on site visits, community events to actually see in real time, letting me sit in on lectures and sit in different educational endeavors to really see what you all are saying, right? Because I like to hear it, but I also want to see it too, because then that way it helps me to craft, okay, well, this is what they meant when they said this, and this makes a lot of sense. As you can imagine, I'm acclimating to the role. I've been in the role for about the last 10 months, and it's been the most riveting 10 months, as you can imagine. So I'm learning a lot about you all. You're learning a lot about me. And it's been really helpful, this symbiotic relationship. So I'll just get into it. So being able to come out and meet a lot of you all, I've heard a lot of the historical concerns about the availability of CNA skills testing, right? That's a hot topic, not just in the district, but also in our region. And so part of that space, I wanted to do a lot of root cause analysis to try to figure out, okay, if this is something that's happening, not just here, but it's happening across the region, what are those main causes? So myself, our senior leadership, and our chief of staff and director of Department of Health, we've been strategizing ways to meet the needs of that testing availability. So one of the first memos, and I think I can share, I've kind of made my screen small. So let me see if I can share this now, and you all let me know if you can see it. Can you see my screen?
Yes, I can see that, but maybe if you could zoom in a little bit more.
Sure, of course. Oh my gosh, yeah. Because I have on glasses, sorry. Tell me when. It's good?
So that looks good. Yes, thank you.
Okay, perfect, perfect. So this came out from myself. This came out on August the 5th. And this was something that we strategized internally to be able to roll out, was actually in our regulation, right? And it's not just a nurse specific or nurse assistive personnel specific rollout and mandate. Temporary licensure exists across a multitude of professional licensures here in the district. But I think that Board of Nursing just was a little behind the curve being able to roll this out in the CNA HHA space. So thankfully, we've been able to roll this out successfully. As per August 5th, we released a memo stating that we are opening up the district for temporary licensure in the CNA HHA candidate space. So what happens is if there is a potential CNA that is applying and kind of like how nurses do, right? We apply and then it's contingent upon passing the NCLEX. In the nurse assistive space, that's kind of analogous here for CNAs, right? So they would apply under DCMR, well, Title 17 DCMR 4007.1. And so that's the temporary licensure allocation within our regulation that you see here. And I'm going to kind of slow down and scroll so everybody can see it. But again, I can always send this. I sent this to multiple stakeholders, but please let me know in the chat, and you can send me any other emails that you think would be advantageous to send out to. So as long as the candidate submits a completed application for certification, they can be granted a temporary license. But let me drill down as to what a completed application means, because sometimes, in our very human way, we're like, oh, we finished it, completed, done, right? But if all the fees aren't paid, it will look like on the constituents end that they applied, right? And they submitted all the documentation requested. But if they didn't submit their actual payment, it sits in draft. So there's a lot of our applicants that say, hey, I submitted this on this time. And we look and we're like, it's still in draft mode, so I can't even see it on my end. It's almost in like application purgatory, if you will. So please make sure that you give a little nice nudge and kind reminder for people to not refresh their screen, not hit back, and make sure that they put that payment information in there and obtain that confirmation. And they can always reach out directly to Board of Nursing if there's any question about that. Because as you see now, technology things cycle. Sometimes you'll blink in and out. It happens, right? So the compliance of the criminal background check, that is hot topic, as you can imagine, right? And so what I like to tell people, because people call me, they're actually calling now on my work cell phone. So it's not beyond me to approve a license and step out of a meeting or step downstairs and talk to anyone that comes in that has any questions. When approving applications, the main hold on our applications is usually a CBC or criminal background check hold. Now, granted, people live lives, right? Things happen. Sometimes people remember, like they can tell you to the date when something happens. And sometimes I talk to people and they're like, ma'am, I don't know what you're talking about. And I'm like, yeah, I know, but it just popped up here. And it's kind of awkward, right? Because it might be something that the mind has forgotten or something you don't want to revisit or go back to. However, every time we do a background check, whether that's by way of fingerprinting or whether that's by way of what's called a name search, right? If you've, for an initial application in the district, you would do fingerprinting. And then if we already have you in our system and you've already submitted application with us for any other license type or renewing, then we would do what's called a name search, and that'll just run the person again for the background check. So as you can imagine, anything can pop up. That's from cradle to grave. And for a lot of us, we're now clinicians, but there might be traffic tickets or anything prior to in our history that we've forgotten, and that can be a hold. So it'll come up on our end as CBC review. And if it's a clear or a clean CBC, it'll come up as passed. But sometimes it'll just be a review. And we just have to tap in internally with our legal team. And we might request from our applicants and constituents a little more information to have insight. That could be court documentation speaking to said instance. That could be the statement speaking to whatever it is that we saw on the background check. There's also possibility of a CBC review that pops up by way of immigration status. So if we see that, we're able to clear that, no problem. The main things that I'm looking for in tandem and in conjunction as per our regulation with our legal counsel is that there's nothing that stands out as a barrier to care. We want to feel confident and feel good about the people going into our homes, going into our clinical settings. We want to know that we vetted all aspects to say these people are safe. So it may come off as a grave inconvenience to the applicant, but remember, we're clinicians today, we could be patients tomorrow. So, we just ask that the applicants put themselves in those shoes, right? And say, hey, as we safeguard the district, we just want to make sure that everybody's safe, right? So that's usually the biggest headache when processing applications. And I know we'll do Q&A at the end, so I'll just keep going if it's okay. And then passing the written, which is online, skills exam, or the written exam online, and then the skills exam, both administered by Credentia. But the thing about the temporary licensure, the caveat with that is we know and have noted, because you all have made it known, reached out to us, called, come up here and really let us know that, hey, everybody's not able to get tested for their skills exam, and they've passed the written successfully, but the skills exam for some have been a holdup. And that could be a multitude of reasons, right? It could be the applicant themselves might just keep um, uh, reapplying or not reapplying or rescheduling their exam, or they cannot get in just by way of scheduling. Another thing that we've been able to drill down on and note is that a lot of our applicants, by way of matriculation, some of them will get ready to take their skills exam, but prior to being able to be scheduled for a skills exam, they might go to school elsewhere in another jurisdiction. So we lose a lot of people by way of that attrition, which we're drilling down on more efforts for follow-up and for outreach with that piece. That is a large subset of people. So with that being said, if you have already attempted to schedule for the skills exam and you are obviously actively in progress trying to sit for skills exam, we take note of that within this memo and within this regulation to be able to allow a temporary license. So obviously, if you sit and take the skills exam and don't pass, then that's another conversation that, you wouldn't technically be able to continue with the full licensure, but then there will be remediation efforts that could happen within the school that you attended in conjunction with our nurse specialist of education and myself. We can help to craft that space out, but we haven't been seeing a lot of that. The main things have really just have been access to skills testing. And so we've been able to work with our third-party proprietor, Credentia, to drill down and say, hey, this subset of people have not been tested. What's going on? What are the variables? And we've done very staunch data analytics to see where different people live in that process. So again, if you've so when you apply for the first time for your licensure, now you can apply with us through CNA through Salesforce. So how you would go through the normal DC licensing portal, how you would with your RN, LPN, CNA. Now, first time CNAs can do that with us at our portal. Before you had to just do it through Credentia, but now we're still within one of our last fixed renewals. So the fixed renewal cycle is still going, and probably for another month as we give that grace period. So that will still be held in the Credentia space. However, after this fixed renewal period and we shift completely to birthdays, then the renewal process will be housed and the registry will be housed in our Salesforce apparatus. And then Credentia will only be the proprietor for testing of the written and the skills, but then DC Health will hold the licensure in our registry. So that is in transition. All right, let me see if I can go down a little bit further for that. More pertinent information regarding the temporary licensure certifications. They're valid for up to 90 days. It is on the responsibility of the training program to be in touch with the student and tap us in as needed to say, hey, we have people that are in fear of not being able to progress to their full licensure. How do we move? How do we notify them? We're here to give very direct guidance for that. Myself, also Ms. Tamara Freeman, who is holding the nurse specialist of education seat pretty much in tandem with me for this space. She's not just in the nurse assistive personnel space, she's also holding dual space for the higher educations as well. So we try to let our constituents and our parties know, hey, give us about 7 to 10 days, because as you can imagine, all these inquiries coming to 2 people for a district, it gets a little crazy. So we just ask for 7 to 10 days, and always feel free to give a little nudge and circle back in the email. I will not be offended if you call me, say, hey, Cam, I just wanted to know about XYZ. I'm here. Email is best for me. So as I'm like talking to you all now, I'm getting emails, and as soon as I get off here, I'll go right to them. So if you want to do that, but then also you have the bon.dc@dc.gov email. And then also our phone number here, 202-724-8800. And so that opens up the likelihood of more teammates being able to reach out to you. You might not even need me sometimes, but I'm here for you. But there's at least about 12 or 13 other people that can assist with your inquiry. Also, the certification authorizes restricted practice under the direct supervision of a licensed healthcare professional. That will be an RN, an APRN, obviously our NPs, and things like that. Our MDs, our DOs, and PAs. It would have to be someone higher in scope, right? Our temporary HHA certifications cannot be issued as HHAs often work independently in home settings. However, individuals pursuing HHA certification who meet the CNA temporary certification criteria may be issued a temporary CNA certification. So to drill down a little bit on that, because I know that could be a bit of a conundrum. I had a couple calls about that piece. Technically alone, an HHA cannot be eligible for a temporary certification. However, if that said HHA has the pertinent education and skills to be able to progress in that CNA space, then they could get temporary licensure, because a lot of our HHAs are pursuing CNA. And then also, as per our CNA amendment of 2024, DC Health is in the progress and process of merging those license types. The HHA license type will merge and sunset into the CNA license type. So then the CNA license type will be built out to be able to expand to the home and in clinical settings. The biggest caveat about that is we've opened that scope up to 16 and 17-year-olds. However, in interest of protecting the minors of the district, 16 and 17 will not work in the home. 18 and up can work in the home, but 16 and 17 will just be relegated to clinical setting. So as you can imagine, there's a lot of nuance with that, but a lot of our HHAs will likely end up merging into CNA soon anyway. So then they would end up being eligible for said temporary CNA certifications. So I wanted to make sure I drilled down a little bit on that, because that's been the bulk of our calls regarding this memo as well. If you'd like, I can pause for a moment before I go to the next memo. Let me know if you want to jump in, and I'm good to go. All right. No, nobody put up a hard stop, so I'll keep going. All
I think
right.
there was a Cam, I think there was, and I'm sorry for being late,
Oh, please.
technical difficulties here. But I think there was a question in the chat.
Okay, I'm sorry. I'm sharing my screen so I can see maybe about 5 faces, but I can't see the chat. What's it say?
Let me see. It says, how are we able to identify the temporary licensures through your CNA registry website? That's coming
How are
from
we able to,
Juanita.
how are we able to identify? They should be displayed how you see in our regular CNA registry. Their names will come up, right? If you're not seeing that, please tap in and let us know, because that could be an infrastructural thing. That just could be a tech thing. But if they are temporary certified, they are recognized as a CNA. But then obviously after that 90 days, then you wouldn't see them after that 90 days. So they should be available to be seen in that registry.
Camesha, I'm wondering, how will you be able to identify somebody who has a temporary licensure versus someone who has a permanent licensure?
So at
or
the
full
actual
licensure?
at the actual place of provision, like where you're providing care. So it'll say they'll submit to you their certification, right? And that certification very boldly states temporary. It gives an expiration date. And I believe it even says to contact us, or just it gives like a disclaimer, if you will, in very bold writing. So it says temporary, and it says, look for this expiration date. If said person is practicing after this date, please reach out to DC Health and all the things. So that would take a lot of vigilance and onus on said place of care provision to say, hey, I got this temporary license from Jane Doe on October 29th. So then in your mind, you would make note as the higher authority, higher scope, or nurse educator, whomever, to say, hey, the clock starts, and then you'll just have to do some staunch HR tracking to say, hey, just like how you would in the hospital, right? Like how we're getting close to, because we're doing birthday renewals. So, they'd say, hey, Cam, you're close to getting to renewal for your licensure about maybe a month in advance. But obviously, if this is only a 19-month stint, maybe towards like after that 60 days, then you might want to start having that conversation with your applicant and say, hey, just and being fiscally mindful, because that's like a month out. That's 2 pays for people, right? So we don't know if people will be able to do what they need to do. So just in all interest of being mindful, maybe midpoint, maybe 45 days in, maybe 60 days in, that would be something that maybe you can place in your policies individually, like your HR professionals and your clinical instructors. That might be something worth talking about. And if that's something you want to parse out better, please reach out and let me know. Ms. Scott, I see your hand.
Yeah, thanks for that. And again, I apologize for jumping on late, but I don't know if you actually addressed this in your memo. But I was on a call meeting yesterday with another association, and what came up was the fast track CNA, Maryland, Virginia. Did you speak about that already? In terms of the fast track pulling
No, I
CNAs
didn't get,
from?
no, ma'am, I didn't get there yet, but
Okay,
that I
all right.
can, no, no worries. No, I love it. It was a great segue. It's a
Yeah,
great
we're
segue.
just
And I
trying to
promise we didn't,
understand.
yeah. No, I love it. I thank you for that. I thank you for that. So can you all see I know I'm sharing my screen, but I'm going from tab to tab. Can you see that I've changed my tab?
Yeah.
Okay, perfect.
Yes,
You do?
we do see it. And if you could kindly just zoom again a little bit for us,
Yes,
that would be great.
indeed. Yes, indeed. Thank you. All right, is that good?
Maybe just one more time.
All right. Ooh, that's kind of big for me, but
Okay, I think,
if it's good for
oh,
you all, then okay, we'll leave
I
it
think
there.
that would be good for us. Yep. It got even bigger. So maybe there was a bit of a delay, but
Yeah. Yeah, it's probably a delay on my end. DC Health does not like outside tech entities. It only likes Teams, it seems. Everybody else, it kind of gives us a little delay. So sorry, the building is very very
thank you so
particular.
much.
Yes, indeed. So this memo went out on August the 22nd to all of our local healthcare stakeholders. I don't want to get into the acronyms because if I forget the acronyms, people get upset. But any acronym you could think of in the district, we've blasted this out. They've shared in their platforms and in their newsletters. Our DC Health has actually blasted it out as well for us for internal and external stakeholders. And so this is what Ms. Scott was referencing prior to regarding the fast tracking, if you will. I try not to say fast tracking. I don't know. I just don't like to use the term, but that's essentially what she's referencing because I try to be mindful of my semantics in this seat, as you can imagine. So this is speaking to what I briefly referenced before, and again, slow me down if I'm talking too fast. This is what I briefly referenced before regarding the CNA Amendment Act of 2024, and that's speaking to making the fleet more robust, right? And increasing the fleet to be ready to meet that need, especially as we prepare ourselves to merge in that sector of the scope. So the temporary licensure part that I just spoke about falls into this. The law establishes a temporary license for qualified CNAs from Maryland and Virginia to practice in district. Application process, DC Health is required to notify applicants within 5 days of receiving a complete application for a temporary license, indicating whether it's been approved. So that goes back to what I mentioned to you before about heavy emphasis on complete application because, you know, people naturally are like, I completed it. Well, completion on your end doesn't necessarily translate to completion of said application. A lot of time there are application deficiencies, like I mentioned about that CBC. If that CBC is still in review, that's an application deficiency. That application is not complete. If another thing which I know is super annoying for people, and I remember when I endorsed in DC, and that was an issue for me. So I've been a culprit too. So that 2x2 passport photo with the white background, just your neck and head. We've gotten a lot of people that take a picture of the passport picture. So as you can imagine, if you have a passport, that glossy film, when you try to upload that in our system, it kind of blurs the person out. So the computer does not recognize it and does not take it as a picture. So that's a very highly preventable thing that happens, but don't take a picture of your passport picture. Go and physically take a passport picture at your CVS, your Walgreens, those places, like how you would for travel. And then the person should have some type of collar or some type of shirt that comes up, scoop neck, so we can see your neck and your head. No other people in the picture. I know it's weird me having to say this, but I have to because the things that we get in here, you'd be surprised. So no other people in the pictures, no other background in the picture, no selfies, no like from this angle. Remember, this is your professional licensure picture. So this picture is a picture that other jurisdictions might see to say, hey, this is so-and-so and they're practicing in this place. So whatever picture you professionally feel comfortable with, if it's 2x2 white background, please submit. But that's usually a hold. Also, we've noted that a lot of our HHA and CNA, either the nurse educators, it could be an office secretary or a coordinator, they assist with completing the HHA and CNA licensure for our candidates, which is fine, because a lot of time there's the need for the bulk help to get people in during the renewal time. It's totally fine. But what we're noting is our candidates are kind of being held because, let's say your office coordinator is just doing 10 at a time and they're just going through, submitting. Well, Jane Doe might not have told their office coordinator, hey, about 5 years ago, I had a reckless driving charge and I forgot to disclose. So the person that's completing the application, in all honesty and purity, they submit the application, they don't know that there's a charge or a hold. And so what will happen is that gets flagged and held to our legal system as if the person wasn't forthright in disclosing. And so again, we don't think it's a sinister thing. It's something that gets lost in translation, right? So something you might want to really drill down with if you're doing or completing the bulk applications for your constituents, for your applicants. Be sure to have them, as they feel comfortable, disclose and say, hey, and they don't even have to tell you, right? Because technically it's none of your business. They don't have to drill down and say what it is. You could just say generically, hey, if there's anything that might come up in a background check, you might want to log into your application to put to upload that documentation or statement speaking to said hold, okay? And just make sure that they know it so that way you're not completing these applications and inadvertently, for lack of a better term, not being forthright, and it's not your fault, right? It happens. Happens more than you realize. And so just scrolling down to that, that's the piece about the application process in good standing. So applicants from Maryland and Virginia must be active and deemed in good standing as CNAs in their respective states. So that speaks directly to reciprocity, right? Because in Maryland, we have those that are CNA, GNA. And if they're in good standing in Maryland and Virginia, then they would just apply in Salesforce and they can do that with us, and we would be able to vet their documentation. Just make sure that if they are the place in the district where the applicant stands to work, that they're getting a DCRN to sign off on their attestations and things like that, right? Because if you're coming in from another jurisdiction, of course, a Maryland nurse can sign off on your Maryland things, but if you're coming into the district, we have to say that a DC nurse, higher in scope, that RN or DC provider in higher scope has written off on said attestations and said things for your education. Reciprocity by endorsement, that's what we mentioned there. That's very explicitly outlined in Title 17, DCMR 9606, that speaks directly to that endorsement piece. Of course, you have people that apply with us by way of exam or first-time applicants, and that's when they do that background check with the fingerprint. And that's when they put up all their first time educational information. But then after they come in and renew, they do the attestations and the education, just the renewal of their education. And they would do that name search in the CBC. They might not have to do that fingerprint again. And then for full certification, for full non-temporary certification in district CNAs from other states should demonstrate current unencumbered registration in another jurisdiction and meet the requirements outlined that I mentioned prior to. So we've gotten a couple people that kind of, I guess, just in all haste and excitement, they apply for this coming from another jurisdiction, but they're not unencumbered. They're not in good standing. So that's what we mean by that good standing. You can't be like, possibly fighting for your license in another jurisdiction and you come over here and say, hey, hurry up and approve my license. It's like, hey, wait a minute, because jurisdictions talk, mechanisms and CBCs and fingerprints, they talk. So we might have to hold because we just have some questions. And again, a hold on the CBC might not be a forever hold. It's just a, hey, let's put a pause in this. Is there anything you'd like to let us know before I say, or our legal says in good faith, that we think you're safe to be able to practice and provide. Yeah. So that's, Ms. Scott, I hope I touch some of those points. And of course, as you know, if you need me to send out anything else drilling down better on this, I can. But I just wanted to go on that, go over the memo that was sent out. Was there anything else regarding that piece? Because I have another memo I could share as well.
No, thank you. That was, thank you so much for that information, for clarifying that.
Yes, ma'am. And again, if you all are anything like me where you can hear it, but then after, I'm famous for this. I'll hear things and I'll say, okay, sounds good. But then like an hour later, I'm like, wait, they said that thing. And now I have questions. You process a little bit later. If you're like me, no worries. We have our direct information for the expanse of our board. So that's for the Office of Health Professional Licensure Boards. So that's for all of our boards. But then obviously, if you want to drill down more for the nursing or nurse assistive sector, we have our bon.dc email, but then I'll share my email as well. So I can be able to pass it or distribute it to any teammate a little bit quicker. And if you want to CC me, hey, Eric, if you want to CC me, it just popped up, sorry, in case you're like, how did she see me? I only could see 5 people. Oh, and now you raise your hand. Now you have some questions. Hey, Eric, what's up?
No, thanks for this. My question was just, do we know yet, like how many people have started doing this? You know, because since the memo is out, like, do you just have off the top of your head, have people started uptaking it?
Give me one moment. Give me one moment, because I'm sharing my screen, but I might have to unshare for a minute because I don't want anything to pop up to show any PHI. So give me one moment. I'll come off of screen share really quickly, and I can try to pull that up for you right now, okay?
Thanks so much.
No problem. One thing about Eric, he's gonna ask me the numbers. Love it. And I'm gonna pull it up right now for you all because I kind of X'd out of everything to make sure I wasn't sharing all the things that you didn't ask for. All right.
A great question. I'll just note that it will also make sure to share the memos that have been shared here with the attendee and registration list so that you all have easy access to those memos that we're going over today.
So that, and thank you so much for that. I think that particular report might not cycle. Today's Wednesday. I might get a cycle of that report. Yeah, I get that on Friday. So I don't have good, clean numbers for that as of right now. So I don't want to give you.
No worries. I was just
inaccurate
curious,
numbers.
and I have a few of our workers that work in Maryland and Virginia in mind that have expressed interest in the past, and I want to kind of tag them and send them through this process so they can work both places.
Oh, for sure. Please do. And as you know, you have the BON email, you have my email. If there are people if you have like a group of people, like let's say you have maybe not a cohort, right? But if you have like a group of people that that fall in that subset that you'd want to just push through, just send them. Especially if they're coming directly from your actual place of provision, like you have them, you've gone through, hey, this person, they stand to lose their temporary licensure around this time. How can we kind of, work together to make sure they can go through for full certification? I'll tell you, hey, these are the deficits, or hey, these are some things you might want to flag. We can work together on that. That's not a problem between myself and Ms. Freeman. But yeah, I don't want to give you inaccurate or old numbers. I don't like old numbers, but I can get you that. I can send that at a later time. And did you all want me to share? Well, actually, I don't even have to share the screen. I could just talk about that. That could just be like my little note piece. But what I'll do is I'll move it over here so I won't look like I'm looking away from you all. So this other memo I was going to address was the August 4th memo that went out specifically to training programs, to DCHCA and other healthcare partners regarding the immediate actions to address the psychomotor testing delays or the skill testing delays. I know that myself and our other members presented to the board a memo that had come up, I think a while ago, that predates my tenure, to revamp and bring it back on the table to look at possible movement to psychometric skills portfolio opposed to a skills exam. The board has not ruled in favor of that. However, as we stand to fine-tune more remediation efforts, kind of look and see, like the variables that I mentioned earlier about the nuances regarding lost to testing, if you will, that subset and that number of people, are like where this is happening, where we can drill down by zip code or by training center, if these things are more nuanced in certain spaces or if they go across the multitude. We're doing very staunch data analytics and root cause analysis to see where the prescriptives will be for that. So I believe that the board would like us to drill down more on origin, points of origin. Are these specific things? Are these more nuanced things relegated to said space of ward, or for does this particular space in the skills testing need a little revamp, right? We drill down and look at content areas as well, like the actual psychometrics of, hey, are more people in the nation failing on this question too, opposed to just DC? Is it something we should just consider regionally and nationally, just like thinking about? So we want to look and have very, very rich drill down of that content space. So again, the board has ruled not to move in that way as of yet, but that doesn't mean that it's not, it can't come back later for psychometric consideration for psychometric attestation, because as you can imagine, other license types are there nationally, other places are there. That's not to say that the district won't get there. Okay.
And can I just jump in, Cam? I'm glad to hear you say that, and I've heard you say that before. So
Yes,
I thank you for your transparency, because can you share with the group who, and I know DC Board of Nurses is working on this, but are there any other agencies, or like who are you working in tandem with to see if we should move forward with the psychomotor skills, or just do another option? Are you looking to other states to see exactly what they're doing? Maybe it just becomes this written exam, maybe it becomes a written skill, but a skill a different way. So can you just share with the group what that looks like?
I sure can. Excellent question. So I have had the pleasure to sit down virtually, in person, on the phone, sometimes late at night, with different training programs and/or entities. I know the NAPTAC Collective has been very vocal and very insightful regarding historics, right? Movement and certain things. We've tapped in with actual training providers, actual students. We do like kind of focus groups with students. Myself, Miss Freeman, I know she's gone to the skills testing events that DC Health has been able to host in conjunction with Trinity. And we kind of ask the students, hey, if you could have XYZ, what could you have? Or what are the things that kind of trip you up when you're taking tests? And, our not just our nurse specialist of education, but also our nurse specialist of discipline, she volunteered her time to come out as well. And they noted like a lot of test anxiety. A lot of students know, right? You can rattle it off, driving in the car, coming there, on the bus, listening to your things. I don't know if they're anything like me where they listen to their recordings and you just know it, right? But then sometimes when you get there, you lose it. I know that happened to me at NCLEX. And so not just the remediation piece in terms of the content areas, but maybe more of a morale or psychological component where, like, because I know in nursing, they do kind of like the ATI capstone, or like a Kaplan, kind of like a send off, maybe within provision of the, like as we're getting ready to have students test, maybe having students sign up and test together, or sign up at the same time. Hey, let's all commit to this cohort that you're pushing out by way of your provider program. Hey, 10 of these students are going to sign up and test together, because there's that strength in numbers, and then maybe they can all fill up that testing event, and then they're with their familiar people that they studied with. And that can kind of decrease some of that anxiety. But to answer more of your question, we reach out to obviously the training providers, DCHCA, DCHA, local universities, Trinity, who else? And I don't want to forget anyone. I don't want anyone to get mad, but UDC, Children's National, we've talked to them as well. Pretty much all of our stakeholders in the district that are willing and have the capacity, even some stakeholders because we have HELC, the Higher Education Licensure Commission in the district. We've talked to their sister organization, MHEC, who is their equivalent on the Maryland side. I also host what's called cross-jurisdictional corridor meetings, Where my equivalent in Maryland and Virginia, we're trying to get Pennsylvania and New Jersey, because Pennsylvania just compacted. We're trying to get Jersey involved so we can have more of a regional view. Because as you can imagine, when we pull our metrics, we do pull our metrics from Credential, and it shows district at a glance up against our national production, and then also with our main kind of overarching stakeholder, NCSBN. That's the National Council of State Boards of Nursing. So we compare all these things across the nation with how the nation's performing. So again, like I mentioned, the district isn't there yet, but that doesn't mean that the district won't get there. Just like I know you all might have read it. I don't know if you have seen the news about it, but NCLEX is going online, right? I know back in my day, I thought I'd never see the day, right? But now it's moving that way because things have to move. We have to, increase the workforce. So just because it didn't happen then doesn't mean it won't ever happen. So pulling that data nationally, talking to our stakeholders in other regions and comparing it has been really helpful. So hopefully to answer your question, we've been talking to anybody and everybody. In lack of a better term. But if there are any other entities that you think would be ideal that maybe I didn't mention, and you're like, oh, Cam didn't mention them, or maybe they're doing this here and I saw this and I wanted to share, we are always open to best practices and just talking and brainstorming about what we can do to move that needle. Always open to that. I hope that helped and that answered.
Thank you.
Yes, ma'am. Am I over my time? I feel like I am.
So we are at time. I want to be respectful of your time and allow you some time to have some lunch. I did want to ask if you could share just if there's any ways that folks on the call could get involved with Board of Nursing,
Yes.
talk into your meetings or any feedback that y'all are seeking from providers. How can we support the work that you're doing? That's so important here in the district.
For sure. And let me pull up, thank you for that. And again, I'll kind of wrap it up because again, I know you all have things to do. It is lunchtime. I'll put our Board of Nursing website in the chat. I'll put my email in the chat. Our upcoming Board of Nursing meeting is November the 4th. They're typically on Wednesdays, but I think that's a Tuesday. That happens to be Election Day too. But the majority of our staff members are going to a conference for training, so we had to move it. But November 4th starts at 9 a.m. our open session, and feel free to come and share with your other teammates or anyone else that's interested. Just that's open, that's public, so you could just come and attend. Actually, it's in person. It's in person, but you also have the virtual option. We're at 2201 Shannon Place Southeast. We're accessible by way of the Anacostia Metro. And don't get me the line about the bus route. I used to know, but I don't remember, but accessible by bus as well. And so, yes, I will put that in the chat. And that's how you can stay in touch with us. Any updates, DC Health also works very closely with DCHA, and we send out any blast information to go out via their newsletter as well. They've been really helpful with that. And then I'll put my email. I'm sorry.
What time is your meeting on the 4th?
It's at 9 a.m. That's our open session.
And can you talk about how soon after your meetings do you post your minutes? Because your minutes were really thorough. So
as per the Open Meetings Act, our minutes should be up. I don't want to quote it wrong. I want to say it's 2 or 3 days, but I can put that information there, but it should be 2 or 3 days. I believe we have to post the meeting minutes at minimum 3 days prior to, as per the Open Meetings Act, and I think 2 days after. But I always mix up the 3 and the 2. So forgive me for that. But I will put all this in. I think I should still have access to the chat, but I will stop here. And I thank you all for the opportunity. Ms. Hall had her hand up, but I'm going to send my email, Ms. Hall, if you want to email me, okay? So I won't be all in people's time.
That's fine. Thank you so much for sending your email so that I can ask my question. Thank you.
Yes, ma'am. Yes, ma'am. Thank you all so much.
Thank you. Thank you for your time.
Thank you so much, Pam. I appreciate all the work you're doing, and thanks everyone for joining us. And I see the information for asking for the email. I'll be sure to get that email out to everyone, as well as the information that's been shared in the chat.